And so, yes, we've been talking about that interview with the Minister of Health. I mean, the last time he and I sat together like this, he was the ranking member on the Health Committee. Today, he is the man in charge of the Ministry of Health. Kwabena Mintah Akandoh, Member of Parliament for Dwaboso, has joined me. Honorable welcome.
Thank you, my brother.
How are you doing?
By the grace of God.
You've been busy.
Very, very. Busy is an understatement.
But congratulations once again.
But I'm enjoying it.
Right.
Yes, I'm enjoying it. I love pressure and challenges. I survived so well in challenges.
I mean, I remember seeing something some time ago that, you know, people put on their CV, they can work under pressure. And then now that person is screaming at the boss.
You don't have to complain. Sometimes I remember those days, anytime there's so much pressure and my father looks at me and says, that is what you signed for, please, don't complain.
But how has it been at the ministry? I mean, you were outside the ranking, now you are inside. How has it been at the ministry so far?
Yeah, the Ministry of Health or the sector is a very critical sector that needs so much attention, so much energy, everything. And there is almost all the time some emergency somewhere you have to deal with. And so it's been good, it's been challenging, and you know, every leader and his or her style. And especially when you want to reset the system, you encounter a lot of challenges along the way. People resist, but if you know where you are going, gradually you take everybody along. And so it's been good. I've received reasonable cooperation from the sector, and I appreciate the cooperation so very much. And it's not been easy, but I think that finally we are getting there.
I remember that when you were appointed minister, one of the first things you had to deal with was outbreak of cholera.
Yes, cholera. That is what greeted me.
That's what greeted you to the ministry.
That's what greeted me in the ministry. That is my ministry for you.
And I remember you saying that this is your baptism of fire. But then looking back and seeing that quite recently you also had to deal with the issue at Tamale Teaching Hospital. Would you say that now that has become your baptism of fire?
Anyway, so it's one of my styles.
Right.
Even when I was in opposition as a ranking member, I used to pay surprise visit.
You did that to Kolebu?
Yes, I did that in Kolebu. Yeah, I did that at some abandoned health facilities and all that. So it's one of my styles that I do not want to sit in the office alone.
Right.
I would want to have a feeling of whatever is going on the ground. And I will want to know how Ghanaians assess healthcare, what they go through, what they see. Everybody and his or her, style. You know, there have been various styles that have been used, and for me, if you want to do the same thing to get different results, that will be problematic. Yeah. And so, once a while, and I'm not going to stop anyway, once a while, I will want to go to the grounds and see for myself what is happening there, and then try to see what we can do to change the system, to reset the system to take everybody along. And that's what we are doing.
And I know that after the doctors called off their plan or their suspension of services, you engaged them again.
Yeah,
so
I did.
What is the state of issues now?
Oh, it's now they are back fully and they are working, and we are all on the same page, and we are working together. Some of these things I expected, but you see, you know me, I am very passionate about what I do, but you cannot tell me that I disrespect people. That can never be said about me. I respect people, I'm humble, but I'm very passionate. The work must be done. Maybe at some point in time, you may not understand me, but it's my responsibility to get you along.
Right.
And so if it must be done well. And so these issues, they'll come, but we'll manage them, and they will all,
But that has not in any way deterred you from your unannounced visits.
It has.
So the hospitals that think, oh, he won't come again.
But it has even encouraged me. You see, sometimes when we are all serving the people of this country, okay? I do not want to go into details of what happened at Tamale Teaching Hospital, but it is not for my parochial interest. We are serving the people of this country. You sometimes have to listen. When you listen and the people want you to do something, you respond to their call.
Right.
You understand? I have realized that this has become very popular with the people. And the people want the minister to know what they are going through. You understand? When I go to places, sometimes I don't use private, washrooms. I use public washrooms.
Wow.
You understand? That is me. I've been a deputy minister before. I've been a member of parliament. This is my 4th term. I've been a ranking member. I don't remember the last time I even used a VIP when I'm even traveling outside the country. No. It's me.
Right.
Everybody and his style.
Okay.
I was born down there, from a very humble beginning. It's not like something I'm forcing myself to do. That's me. That's been part of me.
Right.
My father was not a minister. My father was not a president. You know, so this is how I was born and bred.
Right.
I can't change from that.
Okay.
And so I would always want to see what is down there. And then it's not like, okay, the minister is coming here today, so everybody will go and tidy up the place, they will clean. No, that's not what I want.
Okay.
I want to see what the people go through all the time. And there are challenges. And you see, taking it from here, let me make this point strongly.
Okay.
That our health professionals are working under immense challenges. I can assure you. Going through a lot, and they sacrifice a lot for this country. Right. Can you imagine when the disease is coming and everybody's running away and they call them the frontliners? Everybody's running away. COVID, you remember?
Yeah.
Everybody was running away. People didn't even want to come out. But they are meeting the disease. You know, people are working at places where there's even no electricity. Somebody who was born and bred in Accra, who has schooled his life in Accra, has now been posted into a village where there is no electricity. But he's there working, saving lives.
Right.
You know, so we must begin to do more than we say. Opinion leaders in various communities must show concern about the welfare of our health professionals in our communities. People go to places and they don't even have a place to lay their heads. These are the things the chiefs, the members of parliament, the opinion leaders in communities must begin to concern themselves with. Because irrespective of who you are, when you are sick, you go to the hospital anyway.
Right.
There are situations where we've had ministers and deputy ministers who are falling sick and immediately have to be taken away from their environment. You know, so we must all try to contribute our quota. And I keep citing this example. I had a terrible accident, if you could recall.
Yes.
The first point of call was in Yehini District Hospital. I never thought that one day I could be there.
Right.
So when you have the opportunity like His Excellency John Dramani Mahama has given me today, you ask yourself, what can I also do to improve upon the system? It's not my parochial interest.
Right.
No, far from that. So
interesting.
We'll keep doing our
And
best.
talking about that opportunity, yesterday a program was launched, the Trust Fund, christened MahamaCares. And we saw that it's also an opportunity for us to also contribute. Yeah. But talk to me about the Trust Fund itself. What is it about?
Good. So the Trust Fund is a solution to a prevailing health challenge.
Okay.
At the moment, as I speak to you now, the non-communicable diseases are becoming a monster. About 43% of our mortality in this country is attributable to non-communicable diseases. So if you're a leader, you pause, wait a minute, how do we deal with this issue? And that is why His Excellency John Dramani Mahama, in 2024 general elections, promised the good people of this country that I have a solution for you. We have other diseases being taken care of by the National Health Insurance Scheme. But these ones we are talking about, the cardiovascular diseases, the cancers, the kidney failures, they are very expensive to handle. And these ones, not all of them are on the National Health Insurance Scheme. And so he is bringing a new solution. Because if we decide to put everything on the National Health Insurance Scheme, we'll collapse the scheme. We'll collapse the scheme.
All right.
And so he thought of establishing a fund where we'll use that fund to subsidize the treatment of these non-communicable diseases. And so we'll be looking at how we can get money into the front. Now the policy document is ready, the bill is ready, it's been launched. We have a dedicated sources of funding. And I'll tell you,
Right.
under the MPP regime, the National Health Insurance Fund was capped into the consolidated funds. His Excellency John Dramani Mahama has decapped the National Health Insurance Fund at the moment. So we have some kind of windfall.
Yes.
So he says, no, we're not going to use this one for anything. We are still going to invest it back into the health system. So we are going to take some money from there, put it in the MahamaCares, then look at other avenues.
Right.
Corporate Ghana, the extractive industry, the telcos, everybody. Now, even after the launch yesterday, a lot of people are calling to find out how they can also contribute.
Okay.
Yesterday, His Excellency the President donated his 6-month salary as his contribution. And one of the touching stories happened yesterday was a pensioner who contributed, and he issued a check in an envelope, presented to the president. The president gave back the check to me, and for a very short time, the president took the check back. I want to know what at all can this pensioner contribute. Then he opened the envelope, and it was $1,000 check. That was touching.
Oh, so that was the one he mentioned.
That was the one, Professor Iti.
Professor.
You understand? And so there, everybody started contributing, and the euphoria, and even whilst we were there, people were calling from outside that, look, we are ready, we want to contribute, and how can we contribute? My colleague minister, the Honorable Elizabeth Ofusua-Jare, contributed. I mean, her 1-month salary to the program. Now Momo, also the gender minister, myself, I contributed.
Yes, you contributed 3 months salary. John Mama says he's not been paid, but he's contributed.
It'll be easy.
But that's the commitment that you
must
show
leadership.
Right.
You must show leadership. You are calling on people to come and contribute.
Yes. What are you putting in? What are you putting
in? You know the thing. And so we will be announcing, a short code. The short code is actually ready, but it must take 72 hours after the launch to be activated. And unfortunately, tomorrow is holiday.
Yes.
But we'll start announcing it probably tomorrow. On Friday, we'll continue, and we'll invite more contributions. People have called me. Everybody is ready. We'll start the tour very soon. We'll go to the extractive industries, the mining sector.
All right. Okay. Right, we'll go for a quick break, but when we come back, we'll talk more about whether it's targeted, is it for some people? Because we realize that with the dialysis intervention, it was for certain age groups and all of that. So we'll look at that, but right after this short break. Stay with us.
According to the World Health Organization, non-communicable diseases account for 42% of all deaths in Ghana, with cardiovascular diseases comprising 19% and cancers 5% of all mortality cases. This is why government is inaugurating the Ghana Medical Care Trust Fund, also known as the MahamaCares, to comprehensively address the treatment of chronic illnesses, including cancer, kidney disease, and heart conditions. The initiative is a bold response to these challenges as promised by the NDC in their manifesto. Here is the Health Minister speaking on the need of a task force to implement the policy.
There was no sustainable sources of funding for the dialysis. It never happened. I was a ranking member on the committee, and at the time we even suggested to make provision for dialysis, and they allocated 2 million Ghana cedis. And they had to go and take about additional 2 million from corporate social responsibility. I can tell you, 4 million Ghana cedis cannot take care of dialysis in the whole country. So they need to be a sustainable and a reliable sources of funding. Look, if we decide to put all manner of disease on the National Health Insurance Scheme, it will collapse. We can't afford to put all these diseases on the National Health Insurance. That's why there's a need for us to provide this special purpose vehicle, a reliable one, so that if you are confronted with this chronic disease, it will not be the case that because you cannot afford the treatment, you then be nearing your grave.
Again, The Minister of Health, Kwabena Mintah Akandoh, noted the implementation of free dialysis on the NHIS by the erstwhile government had no reliable source of funding to keep it running.
This fund aims to provide dedicated financial support for individuals battling chronic and debilitating illness and expand access to quality care for these chronic diseases.
In his acceptance speech, Chairman of the MahamaCares Task Force team, Reverend Professor Emeritus Seth Aite, gave assurance of the committee's commitment to diligently making the initiative a success.
We wholeheartedly accept to do this work. And as we said, we'll do it with passion. We'll give it all our heart, mind, soul, spirit, to alleviate the great suffering of people in this nation.
The technical task force is to develop a robust policy and legal framework to establish MahamaCares as a statutory entity, design a sustainable funding model to ensure the fund's viability for generations, establish clear and transparent eligibility and disbursement criteria to guarantee fairness and efficiency, and evaluate the current healthcare infrastructure and suggest improvements to ensure accessibility.
So that was a wrap of what happened yesterday. And fortunately, the minister is here to answer some of your questions surrounding MahamaCare. So, like before I said, before we went for
Actually,
that,
this one was when we're launching the task force.
the task force. Yes, the committee that was put together.
But yesterday's was
the launch
the launch
itself
of the
right
fund. So
and
maybe you may have the
yes, we
videos.
will have that one as well.
Yeah.
But then talk to me now about whether or not it's open to all, because you're looking at chronic diseases, the NCDs, and are there specific age groups who can access this, or perhaps what is the criteria?
Okay,
what qualifies one to benefit from that?
So it's our ultimate aim that every Ghanaian will have access to the fund. That's our ultimate aim. But these are the processes. If you want to access the fund, what you do is that, number one, you must be a Ghanaian. Number two, you must be diagnosed of these conditions,
okay,
at least by 2 medical practitioners. We have had instances where people have been diagnosed of hypertension, and upon the second opinion, they were not hypertensive. And so minimum of two medical practitioners. And then when that is done, you add all the relevant documents, your medical documents, whether referrals or whatever, to confirm that you are indeed in need of that assistance. Then you fill a form. When you fill a form and you submit, maximum 2 weeks, you must get your feedback.
Right.
So this is the process. Now, what we are left with, number one, we have the document, the policy document in place. We have the bill, which will be passed immediately Parliament resumes. We have dedicated sources of funding, and we are going to set up the secretariat immediately. We pass the bill into an act. And now people are also responding to, giving the little tokens they want to contribute to their fund.
Some say this is ambitious, especially looking at the cost involved in treatment. So we're looking at a very huge sum to be able to keep this running. What's the sustainability plan
So
like?
for now, just like the National Health Insurance, as we progressed, we're adding more diseases and more and more and more.
Okay.
For now, we have targeted these ones, and we need a minimum of 3 billion Ghana cedis for the first, second, third years. So this year, we are looking at about 3 billion, and I believe with dedication and commitment that we should be able to raise 3 billion for this year. We should, and we're going to do that.
Right.
Yes, we're going to do that.
Well, people were doing calculation yesterday, so when they subtract that from 3 billion, it looks like we are making some progress. So what are the specific ailments that for this year would be covered under
So the specific ones, the heart-related ones that are not covered by the National Health Insurance.
Okay.
Cancers that are not covered by National Health Insurance. Kidney failures that are not covered by the National Health Insurance.
Right.
So those ones that are not covered by the National Health Insurance, then the MahamaCares comes in handy.
Does that include leukemia?
If it is not covered by the National Health Insurance, why not? We'll look at it.
Then MahamaCares
Yes.
is an
So
avenue.
these are the...
And there's no discrimination age-wise?
No. It's not discriminatory at all. In fact, we won't ask you where you come from, or no.
So whether children, adults, so
Everybody.
long as the condition,
It's
and
a
you can
condition,
you satisfy
all
all
the criteria, why
then,
not? You
right.
will. And we are looking at expanding it in future to be looking at more other things. We are looking at how we can even do research to tell us why, because about a huge percentage of those who fall into this bracket are the most energetic wing of the population,
Yeah.
18 to 45 years.
Yes.
Why? So there must be something. And a testament a lady gave at the program, she thought that this disease was for the rich. Ignorance. So awareness, sensitization. We are looking at how we can even deal with it at its early stages. We don't wait till the complications before you come in with MahamaCare. But we are looking at how we can take care of it even at the primary health care level. And as you know, we are going to roll out another one, which is called the free primary health care.
Okay.
So if you are sick and you go to the CHIPS or the health center, you'll be treated free of charge. So we'll get to a point where you see people even in the market taking the temperature or the pressure or the sugar level of people. There are a lot of people in the street who are hypertensive, but they don't know.
True.
Who have sugar issues, but they don't know. So we must begin to deal with these issues so that we don't get to its complicated stage in the first place. But after doing all these things, and we have some other complications, then the MahamaCares comes in to deal with those ones. So we are committed in finding solutions to this particular health challenge we are battling with.
Interesting. Now, still with the issue of the sustainability, because we've seen, like you mentioned in the clip we played, that yes, we saw free dialysis, yet there was not dedicated source. So this one, we are getting a dedicated source. But then, like you mentioned, the cost involved is very high.
big.
So it's not just uncapping the will not be able to just sort it all out. And that's why we are inviting hands.
Yes.
But then, are we just going to depend on that?
No, that's what I'm saying, that the National Health Insurance is statutory. So a certain percentage is coming anyway.
That's it.
Now, in the law, we are looking at government of Ghana putting something in per every budget we read. So you put something in it. We are looking at the extractive industry. We are looking at the fine details will come when we pass the act.
Okay.
So we are sure and we know what we are doing, that it is a reliable source of funding, so that it's reliable, so that we won't get to a point where we say we don't have money for these
Because
things.
that's the fear.
No.
That we start beautifully,
No.
people, but what if people stop committing
No.
financially to it, then?
There will be some minimum, some basic ones that will rake in every year. And I believe that when Ghanaians begin to know how important it is, how transparent it is, how accountable we are to the people, they will love to give more. I'm clear in my mind. that
So
they will
those
love to give more.
mechanisms for accountability
We
have been
put
put in place.
Clear. Clear.
Interesting. So I'm still having a conversation with the Health Minister, Kwabena Mintah Akandoh. We are talking about the Ghana Medical Trust Fund, which was launched yesterday, MahamaCares, it's christened, and how it's supposed to be a game changer in the health sector, especially because we've had so many incidents of persons who are suffering from these diseases, chronic diseases, and then do not have the means to be able to cater for treatment. And this has come to be able to alleviate their woe. So a lot of people are...
And you see, this is not far from anybody.
Right.
Yesterday, the president narrated how close these diseases have come to him. His father, his mother,
yeah.
his close allies. And you can look back, reflect on it. You can relate. You have friends, you have relatives who are suffering. That at a point in time, they sell almost all their properties. So this disease, when you are confronted with any of these conditions, there are two things. You are either dragged into poverty or you are dragged into the grave. If you have to shoulder the burden alone, it's heavy. But if you all come together to share the burden, it lightens it. You know, everybody in this country can relate. You know somebody who is diabetic. You know somebody who is hypertensive. You know somebody who has died as a result of cancer. You know somebody who has died as a result of heart attack. you know. So we need to come together. It is killing all of us. All of us. You don't know who will be part of the 43%. Will it be you? Will it be your brother, your friend? This is the time to show concern, to show compassion, to contribute something to that cause.
And like you said, the short code will be activated tomorrow, and then we can announce it to the people to let them know how they can also be a part of this particular initiative. But with the advent of the Ghana Medical Trust Fund, what happens to the free dialysis program?
Okay, so just like I said in the video you played, and let me explain this.
Please do.
I've heard it on the social media that people have tried to, put certain things together to mean that I said that there was nothing like national health insurance and all that. I have been the ranking member on the health committee for the last 7 years. And what really happened was that, you know, at a point, I was at the forefront of fighting for people with dialysis, kidney issues. You remember Kolebu issue, I had to pay a surprise visit there and all that. And so within that period, there was this conversation.
Right.
And the government then promised to do something about it. Unfortunately, when they brought the 2024 National Health Insurance Formula, they were absolutely silent. And so the committee then insisted that a provision must be made for dialysis.
Right.
You remember at the time we were saying that Kolebu owe about 2 million Ghana cedis, and that was why they closed. You remember those conversations. So we made a provision of about 2 million Ghana cedis for the dialysis. And then the National Health Insurance Authority then realized that because the money was not enough, they were going to look at people below 18 years and above 16 years, because that bracket, well, there were very few. And then they went to what we call corporate social responsibility and took another 2 million and added. So getting to the end of the year, they realized that they could do more. So that was with respect to the 2024 formula.
Okay.
And so once the 2024 formula is dead, 31st December 2024, there's nothing again.
Okay.
You understand? So if another person comes and the person takes it off the National Health Insurance formula, it means we are back to, ground zero.
Right.
So there must be a sustainable and dedicated sources. And let me tell you the gap we had to come in with. Immediately after the 31st, you know, the teaching hospitals especially didn't have boards, and some of them don't even have boards as at now. So they were working based on ministerial directive. So they got back to me. So, Mr. Minister, the National Health Insurance formula for 2024 has come to an end. But the patients are still coming. What do we do?
Do we give them free dialysis?
You give them free dialysis? I had to say yes, go ahead.
At whose cost?
We will pay.
Wow.
So I said, go ahead. The National Health Insurance, Scheme will take care of it. When we pass the National Health Insurance formula for 2025, we'll take care of it. So go ahead. That is how we have implemented it up to today. So that it's not like they left some money. There was some reliable source of funding for it anyway. This is what we are doing today, so that it will not be subjected to somebody's discretion to either absorb it or not, or to put it on the formula or not. So now that we have a sustainable source of funding, then we have a whole policy, we have a whole package, we have a whole program to run. And the criteria will be clear as to who can assess and how you can assess it.
Now, sector players, I've spoken to some doctors and all of that, and asked the fundamental question of why is it so expensive to treat these conditions? Some say, well, the equipment that we use, and then the consumables that are also brought in, taxis, levies, and all of that. So going forward, are we looking at a plan to make sure that we are able to deal with this, so that at least, even though MahamaCare is running, we also have the costs?
It's a legitimate concern. Taxes on consumables, a very legitimate concern, especially those in the private sector.
Yeah.
It's a legitimate, because at the end of the day, if the ordinary Ghanaian falls sick and he goes to the private facility and he gets treatment, he's a Ghanaian.
Yeah.
What is important is that healthcare, quality healthcare has been delivered. It's a legitimate concern. And so we'll raise some of these issues. Taxes on consumables. And yesterday, His Excellency made a point that we are going to invest in the pharmaceutical industry where they can produce some generic medications in the country to bring the cost down. So that's another angle he's looking at it. So that the cost will not be as much as being...
Because currently we are importing so much.
So much, yeah.
And the import also has its own
True.
challenges.
Less than 30% of our medications we consume or rely on are produced locally. 70% are imported. So much. You go to other countries, about 80% are locally manufactured.
Right.
Quite recently, I had a discussion with the Moroccan health minister in my office, and some of the things they are doing, Charlie, you know, and so
Right.
we'll live up to expectation. So we'll do our best.
So, MahamaCares, I'm interested because, like you said, it affects every single person of us. The NCDs, I have had some stints with the NCD Alliance. I've done some work with them. And when you realize the closeness of the condition and how it takes away life from the victims, you realize that it's something that we need to really talk about. So what would be your word to corporate Ghana watching us now?
Corporate
and
Ghana.
the need to be a part of MahamaCares.
Corporate Ghana must know, and they know, that there is a direct correlation between healthcare, between the health of their workers, between the health of their consumers, between the health of their clients, and productivity. And so, if they want to get more, get the people healthier, invest in healthcare. And as I said the last time, if you invest in NCDs today, you are investing in a healthier and a wealthier tomorrow. So, corporate Ghana, with all respect, and yesterday they showed commitment. Let's all come together. Some of your staff members are going through such conditions. Your clients are going through such conditions. If you want more dividends, more profit, get the people active. Get the people healthier. And that is the only way you can get higher productivity. So productivity and the health of the individual, the health of the citizens are interlinked. It can never be separated. And so we must deal with it. And these are the diseases that are killing the people. And we lose so much when they die. Can you imagine when you have invested in somebody so much? He's a professional. He's a professor. He's a doctor. He's somebody. He's an engineer. The company has invested in him. He's traveled all over. And all of a sudden, a chronic disease takes that person away. You've lost so much. You've lost more than this 53,000. So I believe that everybody should come on board. You belong to a family. You look down there and you realize that everybody, especially when you sit on TV, they know you have it all. So everybody's...
Tell me about it.
Exactly. And so everybody is running to you.
Right.
The person is diabetic, it's hypertensive. Oh, Kofi, can you please help me to do this? So you are shouldering the burden alone. So if today MahamaCares is in full operation, you have a relief, don't you? You have something, you have an alternative, you have something to direct that relative to. You can guide the person to get access and help and relief from MahamaCares.
Quite interesting. But then you also mentioned that the free healthcare, the policy, would also be out soon where you can walk into a CHIPS compound or something, get free. Are we not overburdening ourselves looking at the fact that we have that MahamaCares, the initiatives? Are we not overburdening ourselves?
If government is overburdened and the ordinary Ghanaian is happy, so be it. But of course, straight to your question, we've done the mathematics.
Okay.
And we think that we can do it. In any case, every Ghanaian is contributing to national health insurance. Every Ghanaian, whether you are a subscriber, you are not a subscriber. Today, if you walk out there and you go for lunch, you see national health insurance levy there. It means you are contributing. So we ask ourselves, if every Ghanaian is contributing to it, then at least we should be able to give them the minimum health care, which is the primary one. That you go to lunch, you pay you do everything and you pay, so take this one. And I think that it is not something that we cannot do.
Right.
We'll get to a point where we'll be thinking about the health security of this country, how we can arrest pandemic, how we can arrest epidemics and what have you. We are getting there. And we have policies to that effect, how we cannot be taken by surprise all of a sudden there's COVID and we are running helter-skelter. We must be ready because it will happen again.
Right.
We are not praying for it, but, you know, we don't know when.
We cannot tell.
We cannot tell when.
We
So
just be ready.
We should be getting there.
Okay.
And once you are able to take very good care of your NCDs in your country, you look at it at its early stages, the preventive aspect, the awareness aspect, you realize that when there is any pandemic or epidemic, the toll will not be much. If you recall, during the outbreak, COVID pandemic,
Yes.
you realize that the risk was those who had this
NCDs,
underlying
conditions. Yes.
You remember?
I do.
So if you're able to handle it well, even if there's a pandemic, the risk will not be that very high. You understand? So that is where we are going.
The vision is, that's where the vision is looking.
Gradually.
Right.
Gradually.
Now, you mentioned earlier that in your checks at the various institutions, when you visit them, you realize that our health professionals are doing so well with the conditions that they have been subjected to. Is that not enough reason for them to also embark on the exodus that we are seeing, the flight of health personnel from the country?
Oh, that's another area altogether. Okay. That is not the only factor. When we think about health professionals leaving this country, it's a multifaceted issue.
Okay.
They live in the country. They are affected by the economic conditions. And so he looks at his salary and he cannot do much because of the prevailing economic conditions. And he thinks that he has an opportunity out there. He wants to go. And that obviously is beyond the health minister. You understand?
I do.
And so if we are able to work on our economy, but every Ghanaian, after receiving your salary, you will know that, okay, it can do something reasonable for you. You may not want to travel outside the country. Number two, the hopelessness in the system. And I'll give you a typical example. I spoke to some health professionals. They looked into my face and said, look, I have been a lecturer, I have been a consultant, I have been in the consulting room, a medical doctor, I've worked all my life for this country. I got money and I invested this money in my country. And now you tell me that because of DDEP, I've lost my money and you want me to stay in this country again?
So that also had an impact on a decision by some health professionals.
Yes, he thinks that he must leave the country and go and reorganize himself and come back.
Wow.
The patriotism is waning. I have worked in the country all my life. I have not traveled. I have even lectured. I've invested my money in my country. I've lost it. When he even goes to the consulting room, he's not happy. He wants to leave. He looks at his salary and asks himself, how many years can I build to get a place to lay my heads? So there are a lot of issues. Of course, somebody will ask himself, I've been posted to this facility. Basic equipment, I don't get job satisfaction. You understand? So there are lots of reasons. So we are trying.
Okay.
We will have to think through it together. And then we see how we can complement each other, build on what we have come to meet, and then try and get the best healthcare for our people. Nurses, for example. We have a lot of them at home. Many.
I'm posted.
2021, they are home. 2022, they are at home. 2023, they are at home. 2024, they are at home.
And you described this when I interviewed you at the launch of the health report, that this is a ticking time bomb.
Yes, we are sitting on a timing bomb. So if we don't think outside the box to be able to get these young ones employed, we are sitting on a time bomb. And you see, the truth of the matter is that we cannot employ for employment's sake. If you employ, you must pay them.
Yes.
It has direct consequences on the public purse. So even if we decide to recruit the maximum, the optimum workforce, health workforce in this country, we'll still have excess.
Right.
How do you deal with that? So that is what we are dealing with at the moment, where you remember the Barbados story.
Yes.
So other countries are now coming. We've spoken to, I mean, quite a number of them. How we can, because we spend a lot training our health.
Yeah.
So how other countries who need them can also come on board to help us train them. And then we do government to government negotiations.
Right.
We don't leave them to their fate.
Right.
So government then takes charge of the migration. We have to facilitate the migration.
Very well.
And then we seek for good conditions for our citizens. And then they begin to know that, look, government is showing concern, so that if they go to other countries, the people there will know that, look, their governments are watching whatever is happening to them.
So they'll be very careful.
They'll be careful how they handle them.
Very well.
And so we are looking at all these things. So that's why I tell you that from where I sit, a lot of things.
A lot of
And
things.
you cannot ignore any of them. They are
Right.
all very, very important. I have more than 80 unions under the health ministry.
I don't envy
80.
you. I don't envy you at all.
80 associations. More than
Yes,
that.
yes.
You know, more than that. And you are dealing with, you have the GMA, the nursing and midwifery, the allied. The allied, when I met them 3 days ago, even within the allied alone, they had about 19 associations within the allied.
Mr. Minister, God grant you strength. But
So,
it's been
so you
right.
need to be able to work with them, to understand you,
Right.
what you go through, and the conditions of the country. You cannot speak anyhow. You cannot just give any commitment.
Right.
Because as a minister, once you give the commitment, you are committing government.
And
if
then-
it is not there,
Then.
engage them. Let them know the realities.
Okay.
This is where we are. Okay?
Minister,
Some will be happy.
we'll take our final break. We'll come
Okay.
back. We'll wrap up the conversation. And also, so I'm speaking to the Health Minister, Kwabena Mintah Akandoh. We'll be right back to wrap up the conversation and do birthdays. Well, you're still live on GHOne television. This is Health Alert, and I'm speaking with the Minister for Health, Kwabena Mintah Akandoh. He's also the Member of Parliament for the good people of Dwaboso, and he's been telling us exactly how things have been so far, shedding more light on MahamaCares, and I'm sure that all the questions that you had surrounding that particular trust fund have been cleared. Minister, I know we're wrapping up the conversation.
Yes, yes.
You have a very tight schedule. Like I've said, I don't want to be in your shoes. But then what would be your final words to the people watching?
Well, so MahamaCares today, let's all be part of the story. Everybody must get a complete very soon, as I said earlier, we'll announce the school. Apart from that, the NES should also start gradually. We're going to shape or reset stuff. Now, we have directed that we met the regional hospital, the doctors, and we are also going to meet all the medical arrests in the various hospitals and what have you. We had a situation where government presents or procures to help facilities, and when they are obsolete, it's expected that we can for I think that's the third part.
Right.
So clear and clear that in every hospital we have a clear account where we pay the revenue, the rate of these quick in it. So the initial account for everyone from that account. Just for the facility, or when you want to see that we take some amount in that country. Please, that's the clear. That one, I have that where I'm don't want it per se for them. So about the day run also. Agree, I said we so used to maintain it. You want to use you write us where you crack. That was where even if 10 years you need some amount of repair the also maintain it very well. So that's what we do. So that's one the things beyond them it happens from and we also the fact that charge fees that's out of but please this might be on part of them because you don't have to kill the bird that lays the golden egg. If you go to every facility, where you get most of your revenues is from the equipment, is from the labs. So let's try to retool them. We have also not lost sight of PPP,
Right.
where we'll bring in individuals,
The private
sector to come and set up facilities on the premises. Then they will have a profit-sharing arrangement with the hospitals. And please, hospitals must note that if you give a private sector a place to run, and he gives you a rent of the place, it's not profit. And what I mean here is profit.
Profit sharing.
Profit sharing to the facility. So it's not rent. You must take your rent and then still be interested in. And again, we have also directed every hospital, especially from regional hospitals to the district hospital. Please, you cannot sign MOUs. You cannot sign agreements, no. So if you have anything, you link up with the Director General. Director General will link up with the ministries. You have cases where hospitals have signed
They've entered into various agreements.
And if you, I'll share one with you. I won't tell you the exact place.
Right.
I visited a place behind, the scene discussions. I realized that the hospital has entered into agreement with a private person. That private person is supposed to run the equipment that government has bought. Okay? Run it. The government has bought, has procured, and take 80% of the profit. And then this private person ran it for for some years, and some of the equipment are faulty. Now the equipment have been packed for government to come and fix.
That is very strange.
Yes.
Because government procured the equipment, the hospital entered into agreement with the private person to run it and take 80%.
80%.
And then when the equipment broke down,
Is
government
there as I speak to you now? They are waiting for Kwabena Mintah Akandoh, John Mahama's government, to come and fix.
Interesting.
So when you sit, when you sit at where I sit, you see things. Chief, to tell you the truth, this country, you have no idea how much we are losing to legal suits. Wow. You have no idea. We have one single facility. We've paid more than 7 million Ghana cedis, one facility. So if you don't begin, we don't have the money to even buy equipment. So if you begin to lose these monies, and nobody, the minister will sit in the office, you send people on the field to go and bring me, what do you call it, situational report, or go and do this, then you sit in the, this will not change.
Right, right.
It will not, my brother.
But this used to talk about, is it medical negligence?
Yeah, medical negligence.
Wow.
Yes.
That you have to deal with.
We have to deal with in the ministry. Medical negligence. Suit against us. Wow. Against the Ghana Health Service, against the ministry, and we are going through this. So we must do something about it. At least with the greatest of respect. There are small things we can do to tighten up these things.
And not necessarily have to wait for the government.
It's not my parochial interest.
Right.
I'm a village boy. I'm a common rice farmer. It's
but
not about me.
In all of this, the hospital should still be ready because you're not giving up on the unannounced stores.
This guy. you don't wish me well.
But you said it. But it's quite
so
troubling.
These are the, you see, there are things you cannot talk about. And because people are not privy to, they may interpret it in their own way per how they understand the issue.
Right.
Chief, me, from where I come from, a village boy, I believe that if it must be done, it must be done well. The country has honored me. His Excellency John Dramani Mahama has invited, come and play a role. The least I can do is to give of my best.
Right.
So that tomorrow when I'm not there, people will say, oh, Akandoh was also here some. You understand?
I do.
So I'm dedicated. It isn't all the things that you may like, but I will never disrespect anybody. I will take everybody out. It's not in my nature. People who know me know me. No, not at all. But of course, I'm very passionate about whatever I do.
I recall that in terms, I know we need to wrap up, but I remember some time ago, the doctors started raising concerns about some waivers for their imports and all of that. What's the state?
Oh, we are handling that. We are handling that. Yeah,
you are dealing with the matter.
I mean, we are dealing with the matter so diplomatically, and they are my friends. Oh.
I know.
They are my friends. So we are handling that at our level, and they are all on board, and we are handling that. So we have come to meet a lot of things, but you can't keep complaining, lamenting. Hey, this is no. Then why were you put there?
Right.
So no matter the situation, you must stay the storm. And so that's exactly what we are doing.
Right.
You understand? So sometimes when I look at what is happening in the social media, sometimes I sigh and I laugh.
Now, finally, and I promise this is my final one.
Are you sure it's final?
It's my final one.
Now, I have no idea what I'm going to go through today.
I had a conversation briefly with a health analyst, and it looks like some of the recommendations that they keep making is the fact that, well, in terms of running hospitals, it should not necessarily be a medical doctor running the hospital.
Are you bringing this argument here?
Let's find professionals.
The minister should not contribute to this argument.
the minister is pleading the fifth with that.
Yes. As for this one, please, it's not.
I should let this car pass you by. Honorable, thank you.
Thank you.
I know we've stretched your time a bit. Forgive us, but it's always insightful to have a conversation with you on matters of of Health, and we appreciate your time so much.
Thank you
So
so
Kwabena
much.
Mintah Akandoh, Minister for Health, with that conversation with us. But you know, we are entering a very sweet month, the month of May. It's also my birth month. And this birth month, we are also here at GHOne Television honoring the resilience of motherhood in a very special way. So we are supporting 3 incredible women, mothers of children with special needs, by promoting their businesses and also providing them with seed capital to help them grow. So among them is a mother of twins, both living with autism, and 2 widows who continue to push forward despite the odds. So while many of us take everyday comforts for granted, one of these mothers dreams of simply affording mattresses for her children. So join us. Yes.
So this month is also Purple Month. You know what Purple Month is?
Mental
so we
health.
must mental health. So we must also show compassion towards
Exactly.
people with mental disorders.
Amazing, amazing. And so join us on Sunday, May 11, 2025, as we celebrate their strength, their love, and sacrifice. And so to support or sponsor this initiative, just call Cecil on 054-86-18900. Cecil is a man, so if you call and it's a female, please don't say you are looking for Cecil, and speak to Cecil on 0548